the transition, and third agenda will be digital economy. So on health, his main agenda is transforming a global health system architecture. And President also asked us to be more specific on the deliverables. So it's not only statement, but also concrete deliverables. On health agenda, transforming global health system architecture, we have 5 concrete target deliverables. The first one is to establish a pandemic fund. On these first deliverables, we have been quite successful. So the fund has been established, approved by the World Bank board, and now 11 countries have been agreed to pledge, and 3 international institutions. The total of the fund that has been pledged is 1.3 billion. The name of the fund is Financial Intermediary Fund, managed by the World Bank. Gitu ya. First, concrete deliverables. Yeah. The second deliverables is the mechanism how to use this funding for the future pandemic. Now we are closing in to formalize the previous mechanism that we used during the COVID-19 pandemic. So during the COVID-19 pandemic, there is an informal mechanism used by a global health institution called the ACT Accelerator. So global health institution like WHO, Global Fund, Wellcome Trust, UNICEF, sit together informally to work together how we can provide access to emergency medical countermeasures. What it means by emergency medical countermeasure is diagnostic tools, therapeutics, and vaccine. So every member countries of WHO can have access to those emergency medical countermeasures. Now we realize we need to formalize this structure. So when another pandemic happened, we can quickly use this structure to access the emergency medical countermeasures using the existing fund that we have established. So we are close to get the agreement by the G20 member countries and also the global health institution to establish this formal structure. Deliverables number 3 is the most challenging one. We would like to establish a network of genomic surveillance lab. So when another pandemic happened and is identified in one country, we can quickly send the data to a center lab and share the data to another country. Like when example in SARS-CoV-2 virus identified in Wuhan, sent to GIS-8, and then scientists from Moderna in US and BioNTech in Germany can take a look at the sequence and develop a vaccine. We are still struggling in this area because this data is very valuable. So every country wants to have control of this data. And the discussion, the debate, whether we are sharing the data but also sharing the benefit are still there. Powerful countries that have technology would like as open as possible. But country that has many population would like to get benefit sharing as much as possible. So countries that have technology would like data sharing as open as possible, but country that has many population would like benefit sharing, not data sharing, as much as possible, which is very, very normal. So we are still struggling, but we are keep discussing about this international collaborations on genomic surveillance lab with WHO at the center. Deliverables number 4, we would like to standardize or harmonize the global health protocol standard. Because we realized during the pandemic, usually we lock down the movement of people and the movement of goods. Because movement of people will carry the virus to another part of the world. So when we stop the movement of people, economy stops. And that is dangerous also. So we realize, can we make a mechanism when there is a pandemic, we lock down a country, it's not 100% lockdown, but essential people, important people that have key functions to let the economy survive can still move around with a certain conditions. Like example, pilot or ship operators. Because pilot and ship operators are very important to make sure the movement of people and the movement of goods, especially essential goods, wheat, rice, or medicine, to move around globally. We have the problem when we have pandemic, we cannot import essential medicine come to Indonesia. So we need to make sure this important essential medicine can move globally. So that's why we established a standard of health protocols using WHO QR codes. It's like a passport, health passport. And we have agreed. We have got agreement that we will use a WHO standard health protocols using a QR codes that consists of vaccine informations but also testing informations on top of a normal personal information. So people got this health information certified by WHO, and these people can move around during the pandemic. So this deliverable number 4, we already have got the agreement from G20 countries. So deliverable number 5 is what we are discussing today. It is we would like to make sure we can redistribute the global research hub and manufacturing hub for emergency medical countermeasure, as I mentioned before. For vaccine, therapeutics, medicine. There is another name for medicine, and also diagnostic tools like PCR tests, rapid tests, globally, especially for lower middle income country and especially in the global south. Because before, usually the research and manufacturing hubs are located in the developed country in the northern part of the world. So if something happened, pandemic like this, the developing country, especially in the southern part of the world, don't have capacity, both on the research and also in manufacturing capacity. So that's why we need to develop, redistribute, not only in the developed country in the north side of the globe, but also developing countries in the south, on the south part of the globe. And we have G20 members in the south part of the globe, like South Africa in the Africa continent, India and Indonesia in the Asian continent, and also Argentina and Brazil in American continent. So we do hope that we can build research and manufacturing, large research and manufacturing capacity in those countries. And the discussion is about this. We have 3 working groups already. The first one is Yogyakarta, talking about the 3 agenda. One in Lombok, talking about the 4th agenda. And now the 3rd and the last working group, talking about the 5th agenda. And we will have another health ministers meeting on October, and hopefully another finance and health ministers meeting on November, before the leaders meeting in November, to seal and get the 5 concrete deliverables done by the end of the Indonesia G20 presidency. So I stop here and I welcome question and answer. Please.
Izin Pak Budi. Saya Nyoman Wirya dari CNN Indonesia TV. Pak Budi, yang pertama mungkin dalam bahasa Indonesia. Apa Pak yang disuarakan kali ini Pak dalam pertemuan kali ini? Indonesia menyuarakan apa tentang kesehatan di kelompok kerja ini? Yang kedua, terkait dengan cacar monyet Pak. Apakah ini kan sangat potensial juga seperti pandemi COVID-19. Apakah juga akan dibahas? Termasuk bagaimana update terakhir Pak di Indonesia Pak? Apakah juga akan ada vaksin terhadap cacar monyet ini? Terima kasih.
Jadi yang pertama yang kita ingin suarakan di sini adalah equality. Prinsip-prinsip equality dalam research dan produksi. Karena pada saat pandemi ini terjadi, kalau kita tidak memiliki kapasitas yang merata di seluruh dunia, pandemi itu tidak akan selesai. Karena secara saintifik, kalau misalnya Amerika terjadi pandemi, kemudian kita mengobati orang Amerika saja, pandemi itu nggak mungkin selesai. Kecuali orang Amerika tidak pernah jalan-jalan selama 2 tahun dan dia hanya tinggal di Amerika saja. Dan tidak ada orang dari negara lain yang masuk ke Amerika selama pandemi terjadi. Which is tidak mungkin kan. Karena begitu ada orang lain masuk ke Amerika atau orang Amerika keluar dari Amerika, penularan terjadi kembali. Sehingga konsepnya adalah seluruh umat manusia di dunia harus diobati. Itu prinsipnya pandemi. Jadi pandemi one for all for one gitu. Kalau ada filmnya gitu atau ada cerita seperti itu. Itu sebabnya. Secara saintifik seperti itu. Ya, itu yang kita message utama yang kita ingin sampaikan. One for all for one. Jadi kalau kita punya kapasitas research dan kapasitas manufacture, itu harus di seluruh dunia. Karena nggak mungkin satu negara saja bisa menyelesaikan pandemi yang sifatnya global. Karena penularan itu terjadi antar negara, lintas negara. Itu ya, itu yang pertama. Mengenai cacar monyet. Cacar monyet di Indonesia udah ketemu 1 dan confirm itu positif. Cuma aku mesti bilang ke teman-teman nomor 1 ya. Cacar monyet ini sudah terjadi di dunia 35.000 kasus yang teridentifikasi. Pada masa yang sama, COVID-19 ordernya sudah jutaan dalam waktu yang sama. Kenapa? Karena penularannya dia itu jauh lebih sulit dibandingkan COVID. Jadi penularan terjadi tapi jauh lebih sulit dibandingkan COVID. Penularannya dia itu terjadi pada saat sudah bergejala, berbeda dengan COVID. Jadi COVID itu belum bergejala, dia sudah bisa menular. Itu sebabnya kenapa dia cepat penularannya. Karena orang nggak tahu dia sakit, kita deket-deket sama dia, tahu-tahu kita ketularan. Kalau cacar monyet, enggak. Dia harus bintik-bintik dulu, keluar nanah-nanahnya, baru dia bisa menular. Kalau dia belum keluar tuh bintik-bintiknya, dia tidak menular. Sehingga dengan demikian, menghindarnya jauh lebih mudah. Karena kita tahu, orang ini udah cacar monyet, ya kita jangan dekat-dekat, gitu ya. Yang ketiga, penularan cacar monyet itu nggak semudah COVID yang kita ngomong aja muncul keluar. Cacar monyet tuh harus dengan kontak fisik. Jadi unless kita nggak kontak fisik sama dia, kita dekat-dekat gini itu nggak ketularan. Kecuali ya kita kontak fisik sama dia. Ya, kecuali kita ada kontak fisik. Jadi buat teman-teman, cacar monyet terjadi. Tetapi secara saintifik, dia susah nularinnya. Itu tadi, karena dia penularan terjadi pada saat sudah bergejala. Yang kedua, harus kontak fisik. Sehingga ya kita tahu tuh, kalau orang udah sakit, udah bintik-bintik, ya jangan kontak fisik lah sama orang yang bersangkutan. Itu yang pertama ya. Yang kedua, vaksinasi cacar. Ya karena virusnya sama nih. Bedanya dengan virusnya COVID, dia virusnya virus DNA. Kalau COVID itu virusnya virus RNA. Virus DNA itu lebih besar. Nukleotidanya sekitar 305.000 lah. Kalau virusnya COVID itu sekitar 31.000 kalau di genome sequence ya. Nah, kalau virusnya cacar monyet ini, ya, vaksinasinya sampai tahun 1980, kalau teman-teman ya kayak saya, itu kalau dilihat tangannya tuh, lengannya ada nggak tuh goresan-goresannya? Kalau saya tuh masih ada tuh. Bedanya dengan vaksinasi COVID yang berlakunya 6 bulan, ini sekali divaksin berlakunya seumur hidup. Ya, jadi buat teman-teman yang lahirnya di 1980 ke bawah kayak saya nih yang udah tua-tua, itu terproteksi. Mungkin nggak 100%, tapi terproteksi. Itu menyebabkan kenapa kita melihat di Asia lebih rendah dibandingkan prevalensinya di Eropa. Ada untungnya kita. Karena di Asia dulu kita kena pandemi cacar lebih lebih belakang dibandingkan dengan di Eropa. Eropa cacar tuh lebih cepat hilangnya. Karena dia lebih cepat hilang, vaksinasinya lebih cepat berhentinya. Karena lebih cepat berhentinya, banyak orang-orang Eropa yang nggak punya imunitas terhadap virus ini. Sedangkan orang Indonesia, karena dulu pandemi cacarnya masih kena, termasuk orang-orang kayak saya, itu divaksinasi tuh cacar. Ya, sehingga masih ada antibodinya. Dengan demikian diharapkan orang-orang yang lahir di bawah tahun 1980 seharusnya masih ada antibodinya. Dan satu lagi yang ketiga yang saya ingin sampaikan adalah fatalitasnya sangat rendah. Dari 35.000 yang ada di WHO, yang meninggal teridentifikasi 12 orang. Meninggalnya bukan karena virusnya. Karena di kulit ini kan nggak bisa bikin meninggal. Meninggalnya biasanya karena secondary infection. Jadi udah infeksi di kulit, kemudian garuk-garuk segala macam, infeksi yang masuk ke ini, kemudian kena infeksi bakteri di paru. Dan biasanya meninggalnya gara-gara pneumonia. Atau nanti infeksinya masuk ke infeksi di meningitis, di otak oleh bakteri. Tapi bukan meninggalnya gara-gara infeksi oleh virusnya di kulit. Jadi buat teman-teman nggak usah terlalu khawatir. Ini sudah terjadi di Indonesia, udah ada satu. Nah pesan saya itu, jaga prokes tetap, mesti kebersihan dijaga. Kemudian kalau ada orang-orang yang sudah berbintik-bintik, ya segera dilaporkan. Dan jangan bersentuhan fisik dengan orang-orang yang berbintik-bintik cacar. Jelas sekali kok kelihatan itu ya. Di tangan, di muka, dan khusus untuk cacar monyet berbeda dengan cacar yang lain, mohon maaf, itu di genitals. Ya, di genitals. Kemudian yang kedua, kalau ada, ini surveillance-nya juga gampang. Ini kan prokesnya tadi saya bilang ya, prokesnya kebersihan dijaga. Kemudian kalau sudah ada yang kena cacar, jangan kontak sama dia. Ciri-ciri cacarnya itu ya sama bintil-bintil, kayak bisul-bisul, ada nanahnya kayak gitu, jangan kontak sama mereka. Ya, langsung dibawa ke rumah sakit dokter. Surveillance-nya gimana? Itu surveillance-nya pakai PCR. Kita beruntung udah punya 1000 lab PCR tuh. Reagennya juga kita udah siap, itu tinggal dites saja, kita tahu apakah dia cacar monyet atau tidak. Ya, dan kita pakai genome sequence kita bisa tahu cacar monyet ada 2 tipe tuh, Afrika Barat sama Afrika Tengah. Yang satu fatal, yang satu nggak fatal. Ya, dan biasanya yang banyak di Eropa dan yang di Indonesia tuh bukan yang fatal. Sekarang sedang kita genome sequence kita belum tahu ini variannya yang mana. Ya, tapi kalau kita lihat dianya masih survive aja, itu harusnya yang bukan yang fatal. Mengenai perawatannya, saya bilang ke teman-teman tidak usah terlalu khawatir karena fatalitasnya rendah masuk rumah sakit. Dan meninggalnya biasanya bukan gara-gara virusnya ini, tapi gara-gara secondary infections yang terjadi karena infeksi di kulitnya. Demikian ya, Mas, silakan.
Next question from Nova Sinhua.
Iya Pak, selamat pagi, saya Nufus dari Sinhua. Yang pertama soal global research ini menarik Pak. Untuk menjangkau vaksinnya itu kan kembali terapeutik dan lain-lain kembali ke kapasitas masing-masing negara. Gimana sistem yang bakal dibahas dan dibikin ini membuat negara-negara middle income bisa menjangkau vaksin itu? Apakah akan berbarengan dengan program COVAX Facility dan lain-lain gitu Pak. Kemudian yang vaksin sertifikat ini saya penasaran soal keamanan data, bagaimana ini menjamin keamanan data ini Pak. Dan jangkauannya kan lebih luas ke berbagai negara, lebih banyak orang yang mengakses itu. Makasih Pak. Kalau boleh jawabannya bahasa Inggris Pak.
Oh. vaccine security in vaccine certificate data is very similar in passport data. Passport, we have a barcode. Kan? Now we just change the barcode to QR code. The security is basically the same. You know, how do you secure the data in your barcode? How do you secure the data in your QR code is the same. The information that is recorded in the barcode is the information that is recorded in the QR code. It is secured. You know? It's secured by a certain security protocols, which is secured by the country. Yeah, secured by the country. Yeah, that is to answer your second questions. The first question is, how can we make sure the mechanism for developing country to be able to leapfrog and be prepared as a research hub and manufacturing hubs? So there are two steps that we would like to do. The first step is we will have an agreement between developing countries to establish a virtual hubs. So we have had an agreement with India, South Africa, Argentina, and Brazil to work together as a hub of low and middle income countries for research and manufacturing capacity. So like example, South Africa is dedicated by WHO as a global hub, WHO hub for mRNA vaccine. Brazil has been dedicated by PAHO, itu adalah WHO South America subsidiary to work on mRNA vaccine. Indonesia is working with China under a bilateral agreement to develop an mRNA technology. So we can work, three of us together, on the mRNA research and development, and we will develop the manufacturing capabilities. And then the second step, after we have an agreement, we will work also with developed country. So to have a technology transfer and also commitment from them if they would like to share technical expertise and also to share also not only technology but also knowledge and people to help us. So those are the things that we are working in this meeting. But of course the output will be known after the meeting. Okay, next.
Next question we have from TVRI World.
Yeah. Allow me to introduce myself, Pak Menteri. My name is Devi. I am from TVRI World, and I have two questions for you. Firstly is about the monkeypox, the first monkeypox case in Indonesia. How is actually the condition of the first monkeypox case in Indonesia? And the second is, you've just stated that the effectivity of the COVID-19 vaccine is only lasts for 6 months. Does that mean that people need to take COVID-19 vaccine every 6 months? And is that a sign that the pandemic is quite hard to be ended? That's it. Thank you so much, Pak Menteri.
The first one, the condition of the patient is basically fine. So that is an indication that it is not as fatal as what we are hearing from the news. And again, the data shows only 12 fatality out of 30. Now it's only 35,000. If you can look at the WHO website, if I'm not mistaken, 35,000 is based on the 17th of August data. If I'm not mistaken, when I take a look at 18th of August, it increased to 39,000. You can take a look. So the number is only like 0.05 or 0.04% fatality rate. So it is very, very low, very, very low, because it's only affect your skin, basically. Yeah, you look ugly, definitely, but at least you will survive. Yeah, you will survive. And second, in terms of vaccine, yes, your immunity level will go down, but you still have the cell that remember if this virus coming into your body, that they will create a response. And human immune system is very, very funny. But it really depends on how good your immune system. If you are healthy, if you are not tired, like example, if you have a vitamin D level is high, usually you have a much better immune system than if you are tired, if you are not healthy, and if you are not consuming vitamin D. So some of the people have a better immune response to another people. So whether you have to take another shots, actually is depends on your conditions. Depends on your condition. It is right that the level of the antibodies will go down after 6 months. But when the virus came into your body, the response of your existing immune system varies between people. Some of the people with a very low level of existing antibodies can jump very, very high when the virus coming in. Some of another people will only have a very slow response. It really depends on your basic conditions. Yeah. So my advice: keep healthy, yeah, and don't be too tired, especially when you are a journalist.
Okay, Minister, there's one last question. Who is joining us virtually from Wahyudi from Straits Times. Minister, what are the contentious issues so far regarding global manufacturing and research hubs? For research hubs, so far, which countries tend to accommodate? And is there any early response from drug manufacturers and research institutes from these good initiatives?
It's not contentious. I think it's very common that we need to open the discussion between private sector and public sector. As you might aware, that all the vaccine were produced by private sector. You know, Pfizer, Moderna, AstraZeneca are all private sector. There are no government-produced vaccine so far. However, the public perceptions that private sector benefit by producing and selling these vaccines globally. So the complaint coming from the private sector is basically, we are helping humanity, but we got blamed by humanity. So that is the discussions for the last 3 months. So what we need to improve is how we communicate better between the private sector and the public sector. Basically, what private sector convey to us is they are ready to help the public sector to build, to do research, and to produce and to distribute the vaccine. What they need to us is to communicate to them early. Number one is who are the prioritized segment. Because like now, they don't know who are the prioritized segment. So if one country suddenly I want to buy 5 times my population, they just give it to them. Because they don't realize that, hey, actually the world, we need to prioritize to the health workers and the elderly first. If they know that they have to do it, then they will reserve the capacity to the health workers and elderly first before fulfilling the request of one country just to fulfill the capacity by 3 times or 4 times or 5 times the populations. Second dimension also, when lockdown happens, they have problem, to delivering the vaccine and also getting the raw materials. So how come we are being asked to deliver like hundreds of millions of vaccine, but we cannot get the raw materials coming to our factory? So we need also to get security from the public sector that the raw material movement is still there, and also the logistic to deliver the vaccine is still there also. So that is also the feedback from them. The third feedback is they're also asking, we are ready to give even the free vaccine to the poor country. But we need to understand which one are rich country, which one are poor country. So we can have a tier pricing. So the private sector said, okay, then for the rich country, if you agree, we will give a high pricing. But for the poor country, even we have the only cost-based pricing, which is for them, they are ready to do it. So that's why we also have a private sector or representative from the industry to come into this meeting to have that discussions. Because I think having the discussion with the private sector would be great in preparing us for the future of the pandemic, because the fact is the vaccine, the medicine or therapeutics and diagnostic are produced by private sector. And engaging them early, communicating with them early is a much better strategy rather than blaming to each other. So that is basically the, whatever, I didn't say it's contentious, but the debate that we have at the global level.
Okay, thank you so much, Your Excellency, for your time. This concludes our press conference for today. Apologies to those who didn't make it to the questions due to the limited time. With that, to all the members of the media and the press, thank you so much for joining us. Hope you'll have a wonderful day here in Bali, and see you next time.